I'm Cheryl Dobinson, the Director of Community Programming and Research at Planned Parenthood Toronto. I'm excited to introduce you to a new study we're conducting in partnership with the Centre for Addiction and Mental Health and the University of Toronto. Many people know Planned Parenthood Toronto for our pivotal role in providing non-judgmental, confidential, and sex-positive sexual and reproductive health care to the youth of Toronto. In fulfilling that mandate, we also conduct research to gain insight into the needs and challenges that youth may face around their sexual and reproductive health. Our new study, called Understanding the Sexual and Reproductive Health Needs of Young Bisexual Women, aims to improve sexual and reproductive health outcomes for young bisexual women in Toronto. This includes trans and cisgender women who identify as bisexual, pansexual, or other non-monosexual identities, who feel attraction to people of more than one gender, and/or who have sex with people of more than one gender. Bisexual people have often been left out of research. When included in studies, our responses have often been combined with the responses of gay men and lesbians. This means that only recently are we starting to gain a clearer picture of some of the health challenges and service barriers that bisexual people experience. Current research indicates that young bisexual women experience a number of disparities around sexual and reproductive health compared to their heterosexual and lesbian peers. Teen pregnancy rates are 2 to 10 times higher. Sexual risk behaviors, including having sex at an earlier age, having more sexual partners, not using condoms, and engaging in anal sex, are highest for young bisexual women. All these findings suggest that young bisexual women are at greater risk for poorer sexual and reproductive health. What our research team wants to find out is why, and even more importantly, what changes we and other healthcare providers can make to better support young bisexual women around their sexual and reproductive health.
Hi, I'm Dr. Corey Flanders, and I work with Dr. Lori Ross, who's the lead scientist for researching for LGBTQ health here at the Centre for Addiction and Mental Health. We are partnering with Planned Parenthood Toronto to help investigate the sexual and reproductive health needs of young bisexual women living in Toronto. Mental health is an important component of overall health and can influence sexual and reproductive health in a number of ways. For example, it can influence who people choose as sexual partners, how they make decisions regarding birth control and practicing safer sex, and whether they feel able to set and maintain boundaries within sexual partnerships. Members of sexual minority groups tend to report poorer mental health compared to heterosexual people, and in particular, bisexual people seem to be at a greater risk for negative mental health than either lesbian or gay people. This may in part be due to the unique discrimination experiences that bisexual people face. For example, some people still believe that bisexuality doesn't exist, and it's thoughts like this that are hurtful and oppressive for bisexual individuals. It's not uncommon for bisexual people to also face discrimination within the healthcare system. Healthcare workers, including those in mental health services and sexual health services, may lack the appropriate understanding or training in order to meet the unique sexual and reproductive healthcare needs of bisexual people. This in part is due to the lack of relevant research to help inform these healthcare practices. This is something that this study aims to change.
Hi, I'm Professor Carmen Logie here at the Factor Inventage Faculty of Social Work at the University of Toronto. I'm very excited to be working with Cheryl Dobinson and Corey Flanders on this first ever community-based qualitative research project with young bisexual women in Toronto looking at their sexual and reproductive health needs. We'll be holding 4 focus groups, each with 8 participants for 2 hours in duration. And from across the Toronto area, we'll be asking young bisexual women about their sexual and reproductive health needs and their experiences trying to get these health needs met. We really want to know what they need in terms of healthcare, service, education, programs, and support to promote their sexual and reproductive health. Throughout this project, we'll be working with an advisory committee of 6 to 8 community members, all young bisexual women between the ages of 16 and 29, and they'll help us in several ways. First, they'll be helping develop our participant recruitment plan It's important we recruit young bisexual women from diverse social locations with a variety of life experiences. Second, the advisory committee will be helping us analyze our qualitative data. And finally, as we move into knowledge translation, the committee will help play a key role in developing fact sheets, planning and holding our community event, and informing other parts of our knowledge translation. We want to ensure that our findings are shared in effective, accessible ways that will directly benefit the community. That is, after all, why we do what we do.
It's going to be a busy and exciting year. Thank you to the Women's Exchange at Women's College Hospital, and we look forward to seeing you at our community event launching our findings in January 2015.